Hello everyone, welcome to sqadia.com. Today the topic of our lecture is phobias. So this is what we're going to discuss today. It's basically a kind of an anxiety disorder in which the person has a persistent or intermittent fear about an object, or it can be even to a situation. So this is how we basically define phobias, and the common types of phobias that we usually come across are the social phobias. It can be the agoraphobias or the claustrophobias. So these are some of the examples of the phobias that we'll be discussing in this section in this lecture. So the first section basically comprises of the phobic disorders in general. We'll be discussing the types of phobias along with the prevalence rate. So it is a kind of a disorder which is quite underrated, and the risk factors will also be discussed in this first section. So the risk factors can be relating to the individual himself or herself, or these can be some of the environmental factors or some incidents in the life, in the person's life that can make him more prone to these kind of phobias. So we'll be discussing all of these situations in this first section. Now, the second section basically comprises of the phobic disorder syndrome. So there are a lot of comorbidities that can coexist with this phobic situation. So we'll be discussing how phobias correlate with a lot of organic disorders as well as a lot of psychiatric disorders. Now, the behavioral and cognitive symptoms, they're always present in such a person. Even the person's thoughts as well as his actions are affected in these kind of syndromes. The agoraphobia somatic symptoms are one of the symptoms that can be considered over here, in which we have the physical symptoms along with the agoraphobia. Agoraphobia is basically defined as a kind of phobia that is experienced by a person in open spaces. And usually the person will give you a variety of complaints. Some people would complain of feeling restless while they're eating in public. Or even this restlessness or this anxiety can be quite extent in a lot of individuals that they cannot even possibly eat in open spaces or in public. So the social phobias and some of these special phobias that are related to the animals, or if they're related to the environment or any situations, they'll be discussed over here in this second section. The third section mainly comprises of the psychological assessment of such patients that are suffering from phobias. So this assessment is basically started on right from the point when the patients walk in to your outpatient departments and you're concerned about the patient's anxiety. Even his fidgeting is to be taken into account, his speech is to be taken into account, his thoughts are to be taken into account. All of this are going to pinpoint the anxiety levels and then the severity of the symptoms in a particular person, whether it is a mild, a moderate, or a severe kind of a syndrome in that particular patient that we are treating. The other key features of this morbidity, of the psychological anxiety, will be discussed over here in the third section, and the assessment of the comorbidities, whether they are of the organic type or whether they are of the psychiatric type. We'll be discussing them in this section. Lastly, we'll be discussing the fourth section, which basically comprises of the psychotherapies and the medications that include the general principles of management, as well as we'll be dealing with the CBTs, known as the psychotherapies, or the medications that usually comprise of the serotonin reuptake inhibitors. We'll be discussing them over here in this fourth section. So I hope you want to learn more about these phobias and fears. So do watch the other sections to this lecture as well.